Tell me about Malo Smiles.
Sure, Andy. My group has been practicing implant dentistry for decades. We've placed thousands of dental implants, and we've treated very complex cases. We became frustrated by these cases where patients need all of their teeth replaced. Why? They typically don't have enough bone to put 6 or 8 implants. That's what we're taught here in this country. We're taught we need 6, 8 implants straight up and down, from front to back, and often you have the sinuses in the back of the upper jaw or the nerve in the lower jaw, the one that makes your lip fat and tingly and you're drooling all over yourself after you've seen the dentist for a few hours. That's in the way. We thought that we needed to add bone so that we put implants without hitting these structures. Well, now we know that it's not necessary. Now we know instead we could just tilt the implants away to avoid those structures and place them in the bone that's maintained in most of these patients. That's been a revolution. Where did we learn it? In Europe, because that's where it was pioneered. See, our residency programs, our training programs here in this country don't teach this technique.
Is it because we're more regulated and they're able to do things
first?
That's
a very good point. The European Union's equivalent of the FDA is a little less stringent, so things are approved there much earlier. But implants were invented there, pioneered there, and every innovation since has taken place in Europe. Our European colleagues are ahead of us here in North America when it comes to implant dentistry. Now, there's no shame in going there to learn about a fantastic procedure. That's what we did. We went, we called Malo, we said, Dr. Malo, we'd like to come and learn about your procedure. We've read your research. We understand it works fantastic. We'd like to see if it works in our hands. He was receptive. We went many times. We became very close. In fact, 2 years later, we started to collaborate on research with them, education with them. Now we lecture side by side together all over the country. So our group is very unique. We went, we got this information, we learned how to do it, we brought it back here, and now we train others.
So your centers are known, you're teaching people how to do it very quickly.
Very
right?
quickly.
Same day.
Yes. Same
people,
day.
Their mouths are a disaster.
Yes.
They're trying to avoid dentures. Same day they get a fixed set of teeth. Or the denture wearers come in and they get a fixed set of teeth.
Absolutely. Majority of the time. There are cases where there's just so much infection, so much destruction in the gums. You need healthy gums to attach around these implants, right? So sometimes you have to delay, take teeth out, and then come back a couple months later when the gums grow back. But the majority of patients, I would say well over 95%, can the very same day. They come in for the procedure, give them a little sedation, numb them up, take any teeth that need to come out. If they're already a denture wearer, just go ahead and place the implants. 2 hours later, they've got fixed teeth being attached, and by the early afternoon, they go home, and that night, they're enjoying dinner with their brand new set of teeth.
They can eat whatever they want.
Really a revolution. Early on, we have to limit the diet to a modified soft diet. They can eat reasonable things. Once those implants bond to the bone, they can eat anything they want. That's about 8 weeks. So for the first 8 weeks, they're eating normal foods, but nothing too hard or crunchy. They're not ripping or gnawing into a frozen candy bar or very tough meats. That you have to wait the 8 weeks for. But they're eating chicken, well-cooked vegetables, tender meats, things you would normally eat every single day, yes. So they're not limited. They're not limited to mashed potatoes or oatmeal or other mushy foods, scrambled eggs and whatnot. These patients have a new lease on life because now they're enjoying all those things they used to love. Nuts, apples, raw carrots, corn on the cob is a big one. Patients miss eating corn off the cob. They got to cut it off with a knife. Now, they bite right into it and they're loving it.